Hello friends. So let's today discuss why should we floss our kids' teeth. Me practicing exclusive pediatric dentistry since year 2010. It's been almost like 9 years I'm doing that, and what I have noticed is more than 70% of kids coming to me with cavities are because the parents are not flossing their teeth. As I have previously discussed, what happens when we brush is we tend to brush the cheek part of the tooth, the eating part, and the part towards the tongue side. But what we miss is between the teeth, and it's the place where those cavities usually develop. So these areas has to be flossed by parents for their kids like this in each tooth. Now discussing what happened in one of my recent cases was, as you can make out, there was a small cavity forming in between the tooth. Now this tooth is an upper molar. The parent went to a dentist, but seeing the size of the cavity visible, they thought usually no treatment is required, and hence they couldn't take an x-ray, and the parents were also calm because the size of the cavity they saw was not very big. But 6 weeks down the line, the child had a swelling with respect to this tooth. And the reason was the parents underestimated the issue of cavities which develop between the teeth. What happened was the size of the cavity, which was looking very small from the top, on taking an x-ray, it was big. And why it was big was, if I remove this teeth, see how big the cavity had become. And this big cavity was so bad that it had destroyed the bone below the milk tooth, and the child had an abscess. So that's why we pediatric dentists always recommend taking x-rays of various sides of the teeth, usually bite wing x-rays they are called, to detect such small cavities which sometimes are not even seen through the naked eye or on a regular dental examination, and can be seen only on a dental x-ray. And as famously said, a stitch in time saves 9. So if a dentist knows that a small cavity is developing there between the teeth, accordingly home and professional measures can be advised. So it's my high recommendation, whenever your dentist suggests taking few extra radiographs, kindly trust him and look for those cavities which develop like this between the teeth, and your child can be saved from those abscesses and tooth removals. Thank you. Happy flossing.